activity and keeping up with personal precautions. With more opportunities for social gatherings, festivals, and travel for many people, staying up to date with COVID-19 vaccines, improving ventilation, and continuing to wear a well-fitted mask can help reduce the risk of infection and spread to others. Some of our COVID-19 habits, such as staying home if you're symptomatic, can also help prevent other infections, including monkeypox. Globally, at least 1,285 confirmed cases of monkeypox have been reported from 28 non-endemic countries. As of June the 8th, in Canada, as of the 17th of June 2022, 168 confirmed cases have been reported. 141 from Quebec, 21 from Ontario, 4 from Alberta, and 2 from British Columbia. We continue to collaborate with provinces and territories, as well as partners, such as community-based organizations and representatives from affected communities, to monitor and respond to the evolving monkeypox situation, including supporting provinces and territories in the efforts to roll out targeted vaccination campaigns. As well, we are working together to raise awareness of how the virus is transmitted so people can take steps to properly protect themselves, their friends, and their loved ones. Among cases for whom information is available and has been reported to the Public Health Agency of Canada, all cases are male and ages range from 20 to 69 years. Our provincial and territorial colleagues inform us that many cases report sexual contact with other men, though some cases are still under investigation. However, the risk of exposure to monkeypox virus is not exclusive to any group or setting. Anyone, no matter their gender or sexual orientation, could get infected and spread the virus if they come into close contact with someone who has monkeypox or the objects that they have used, like personal objects, towels, or bed linens. With upcoming celebrations and festivals such as Pride events, we want to ensure Canadians have the knowledge and tools they need to safely take part in these celebrations. So let's use these events as an opportunity to get the word out and work together to stop the spread. We will be pleased to answer any questions today. Thank you. Merci, Miigwech.
Bonjour à toutes et à tous. Les indicateurs de transmission de la COVID-19, dont le nombre quotidien de cas, le taux de positivité des tests de laboratoire et les signes issus des eaux usées se stabilisent à l'échelle nationale et on constate une diminution constante dans la plupart des régions. De même, plusieurs tendances des maladies graves diminuent également dans la plupart des provinces et territoires. À quelques jours du début de l'été, l'amélioration constante des indicateurs épidémiologiques est une excellente nouvelle qui a permis de continuer à assouplir et à suspendre les mesures. Si nous avons bon espoir de voir la trajectoire actuelle s'améliorer, nous observons les premiers signaux d'une activité accrue dans certaines régions. De même, on observe des signes de croissance dans plusieurs sous-lignées émergents d'Omicron, notamment BA2.12.1, BA4 et BA5, qui ont démontré un avantage de croissance et un échappement immunitaire supplémentaire par rapport à BA1 et BA2. La COVID-19 nous a montré au cours des dernières années qu'il pourrait y avoir d'autres surprises à venir. Le virus circule toujours au Canada et à l'étranger et des facteurs tels que l'évolution du virus et la diminution de l'immunité devraient avoir des répercussions sur la propagation de la COVID-19 dans l'avenir. Nous ne nous attendons pas à ce que notre progression soit linéaire. En conséquence, le maintien de l'état de préparation à une résurgence potentielle qui pourrait
Using sunscreen, COVID-19 readiness means maintaining awareness of local disease activity and keeping up with personal precautions. With more opportunities for social gatherings, festivities, and travel for many people, staying up to date with COVID-19 vaccines, improving ventilation, and continuing to wear a well-fitting mask can help reduce the risk of infection and spread to others. Some of our well-honed COVID-19 habits, such as staying home if you're symptomatic, can also help prevent other infections, including monkeypox. Globally, at least 1,285 confirmed cases of monkeypox have been reported from 28 non-endemic countries as of June 8. In Canada, as of June 17, 2022, 168 confirmed cases have been reported, 141 from Quebec, 21 from Ontario, 4 from Alberta, and 2 from British Columbia. We continue to collaborate with provinces and territories, as well as partners such as community-based organizations and representatives from affected communities to monitor and respond to the evolving monkeypox situation, including supporting provinces and territories in their efforts to roll out targeted vaccination campaigns. As well, we are working together to raise awareness of how the virus is transmitted so people can take steps to properly protect themselves, their friends, and loved ones. Among cases for whom information is available and has been reported to the Public Health Agency of Canada, all cases are male and ages range from 20 to 69 years. Our provincial and territorial colleagues inform us that many cases report sexual contact with other men, though some cases are still under investigation. However, the risk of exposure to monkeypox virus is not exclusive to any group or setting. Anyone, no matter their gender or sexual orientation, could get infected and spread the virus if they come into close contact with someone who has monkeypox or objects they have used, like personal objects, towels, or bed linens. With upcoming celebrations and festivals such as Pride events, we want to ensure Canadians have the knowledge and tools they need to safely take part in these celebrations. So let's use these events as an opportunity to get the word out and work together to stop the spread. We would be pleased to answer any questions today. Thank you.
So it's time for questions. C'est le temps des questions.
It's the time for questions. Everybody can have one question, one follow-up.
If you have not already raised your hand, please raise your hand if you would like to ask a question. The first question will go to Lauren Pelly from CBC.
Good morning. On the monkeypox front, we're hearing from patients that they are often stuck in isolation for quite some time. It can be weeks, even a month or so before the lesions resolve. So it's quite an extended period of time for people to be off work, isolating at home. Does the federal government have any plans to offer any sort of housing or financial support or wraparound services, to make sure the provinces can allow these people to isolate for quite a long time, far longer than anyone typically had to, even with COVID?
Yes, thank you for the question. And you're right. And we're still, of course, obtaining more information about monkeypox in the current context. But until we know more, the most precautionary thing to do is to protect against transmission, is to be isolated potentially until all your scabs have healed and fallen off and your skin is beginning to reform underneath. So that can take a considerable period of time. And I think Canadians have helped each other, throughout this pandemic. Certainly we encourage that. I think all levels of government needs to do what they can to support people in isolation, because we've learned, of course, throughout COVID-19 that people want to follow public health measures, but they need to be supported in certain instances to do so. But I think I would certainly encourage all levels of government to think about how this can be done. And this is not the only infectious disease that is going to affect our communities. So I think figuring out what has worked and providing the necessary support is a really good thing to do.
We're also hearing from experts in Canada, the US, and Europe a great deal of concern over what could happen in terms of transmission of this virus in the summer, with so many gatherings coming up. Can you talk more about the federal plans to curb transmission? Because we really haven't seen these cases plateau. It seems to just continue spreading, and there's a lot of fears that that will really spike in the next month or two. So any more details you can share on that front?
Yes, so we have been meeting with experts, provinces, and also local health departments, because there are a number of them that are more specifically impacted at this point, including Montreal and Toronto, and looking at all the different ways that we can break the chains of transmission. So one of the key things that we're doing, of course, is increasing awareness, both in the impacted communities, but also amongst health workers. Getting the information out to through non-governmental organizations is really key, because they have the trust of the community. They know how to communicate amongst their network. So that has been really tremendous. We met with 29 organizations that are very enthusiastic about supporting the increased awareness in the community, particularly as some of the celebrations and gatherings such as Pride is coming up. And be able to frame the messaging in non-stigmatizing ways. And businesses, private sectors have a role. So local health authorities have been engaging with them for them to play a role in making sure that we can reduce chains of transmission, because we know how to protect each other from spread. The other thing is, of course, getting more messaging out on social media, engaging dating apps. And we thank dating apps such as Grindr, for example, for their role and collaborating with us on getting messages out. And then, of course, providing healthcare providers with the tools that they need to diagnose people. And because some of the skin lesions, for example, can look like other skin lesions, and then how they can test for the virus. All of that has to be disseminated. Webinars are being done in different places in Quebec as well. And also, of course, the mobilization and pre-positioning of the vaccine. And that has been done it's been essentially pre-positioned in almost all jurisdictions, in particular in Ontario, Quebec. The uptake of the vaccine is being quite tremendous in Quebec, because they managed to get the word out through community groups and locally, and so far that's been going well, with I believe over 3,000 people vaccinated. Ontario beginning their campaign as well ahead of some of the festivities. And then we have the antiviral treatments. Those don't necessarily break chains of transmission, but they're there to treat those who might be seriously sick or have difficulties because of the lesions in swallowing, eating, for example, or pain. So I think that those are the things that we're very fortunate in Canada that we can do, because we do have some of the countermeasures, but working globally is extremely important. And I know that the WHO is having a meeting next week to discuss monkeypox, but there will be continuous reintroductions into the future if we do not collaborate and support African countries, for example, because they are the ones with ongoing transmission in an endemic state. So there's lots that is happening, and lots more that can be done, I think, in moving ahead. In terms of the cases and the trajectories, yes, there are more cases. Local health authorities are telling us that the rate of growth seemed to be slowing. But we will have to watch that over the next weeks.
Helps if I unmute myself. Next question, Raisa Patel, Toronto Star.
Hi, thanks for taking our questions. We've been told that the government plans to get more rapid tests instead of phasing them out. Do you have any details on how many more will be obtained and when, and also whether they'll be able to detect new variants?
Dr. Tam, you're on mute.
Sorry. You would think I would know better after 2 years. Anyways, thank you for the question. No, I don't have any details. We will have to get back to you on that one because I'm not directly involved. But I do know that for the national emergency strategic stockpile, the idea is that there will be one, so that it's a surge capacity to the provinces if that is needed. And as to whether they work or not, of course, as the variants emerge, they'll have to be tested against the different types of rapid tests, and the characteristics of them might be different and evolve over time. So it is something that we have to continuously monitor and test.
And as we know, many Canadians are testing positive on rapid tests these days. Do you have any updates on whether those test results are being counted in official case counts? And if not, how will you know whether we are in another wave and whether we need to end the suspension of restrictions like vaccine mandates?
Yes, so I don't think we're capturing all the rapid tests. That's, I think, pretty clear to me. Many people are doing that themselves or in other settings. There are some jurisdictions trying to capture some of that. But off the tests that we are doing, we can monitor trends, and including wastewater signals as well. Which is why, in my update today, I'm saying that, we've had a number of weeks of decline in a number of indicators, but there are some ups and downs. And so including in the wastewater signals. So some areas of Canada might be beginning to see a bit of a rise. That could be due to multiple reasons, including increase in contacts, but also we're watching those variants as well. So we are able to, through our current surveillance systems, which is not about testing every case, but enough that the trends can be observed. And I think we are able to still do that in a combination of ways using the different systems. And it is important to do PCR because we need to get the virus samples in order to sequence them and see what kind of variants we're getting. Some variants, of course, escape certain screening tests, and we have to monitor that over time as well. But I do think that the virus is very much circulating around the world. And so we might see some bumps even in the summer, but we have to prepare for the fall where there's going to likely be more activity.
Raymond Filion, TVA.
Raymond Filion, TVA.
Raymond, t'es sourdine.
Désolé.
Raymond,
Sur l'augmentation justement des cas que vous êtes observé dans certaines régions du Canada, on voit qu'en Europe actuellement, c'est le cas aussi dans certains pays, des augmentations de cas COVID-19.
There is an increase in COVID-19 cases. Could the next wave come as early as this summer? Thank you for the question. This is Dr. Njoo here. This is something that we're looking closely at, and we mentioned it this morning in our notes, that we're looking at the BA4 and BA5, and what we're seeing right now is the percentage of results from the tests. So for BA4 and BA5, we've seen an increase over the last few weeks.
So especially the BA4 and BA5 do have an advantage. They have an immune escape with respect to other variants. So this is something that we need to follow. Also, we have possibly some indication that they do have immune escape for the BA4 and BA5 variants. So what you've seen in the States and in Europe, for example, in Portugal, it is possible that there could be an increase here, a resurgence here in Canada over the next weeks. And so that's why it's very important. We always note that even if the vaccines are not 100% efficient in stopping transmission, we can see with the scientific data so far that you still have a good protection against severe illness with the vaccination. So it's very important to get your booster doses because this is for the protection of the population. And to keep up the immunity within the population, because it will be waning over time. So it's always important to stay up to date with your boosters, and especially if there's a resurgence of cases this summer. So yes, that is the quick answer. But yes, we are following very closely what is happening elsewhere, and it is possible. It is possible there could be a resurgence with BA4 and BA5. Thank you. The FDA in the States have approved Pfizer Moderna for children from 1 to 5 years. So what's happening with Health Canada right now? Will there be an approval from Health Canada very quickly, maybe over the next few days? Well, thank you for that question. I cannot speak for Health Canada, but what I can tell you is that, yes, Health Canada has received the application from Moderna, and they're still involved with their analysis to look at the scientific data that the company has provided for their approval. So we're waiting for this approval. It may be coming over the next few weeks. I can't give you an exact date, but that is the situation right now in Canada. And we know that in the United States, what is happening right now, Moderna has made an application for the children under 5 years.
How to pronounce your last name? Jamie?
Oh, hi. Sorry, I did not hear you guys say anything. I'm here. Can you hear me?
Yes.
Oh, hello. Okay. Dr. Njoo, I'm just going to ask you to repeat that answer in English about the COVID-19 vaccine authorization for kids under the age of 5 and where we are with those submissions here in Canada, given what happened in the US and the authorization with the FDA today.
Yes, thank you very much. Very simply, at the present time, the submission that's in play that has been submitted to Health Canada is from Moderna for the vaccine for children under 5. Obviously, our colleagues, the regulator at Health Canada, they're still in the process of reviewing the evidence, and certainly we can anticipate a decision, in the coming, I would say, weeks or so. I can't give you a precise date. Obviously, they need to do their due diligence, and maybe further to that point, that the only submission that's been officially put forward to Health Canada is from Moderna at this point in time.
Thank you. And then my follow-up question is for Dr. Tam on monkeypox, or both of you, whoever would like to answer, I guess. There was a small-scale study that found the current patients who are suffering from this strain of monkeypox, whatever that may be, there was the virus found present in their semen. Given that, we've been talking about how this isn't an STI, and the WHO is looking further into these reports. What is PHAC kind of doing to stay on top of that? And does that change the way we put forth public health recommendations, I guess?
Yes. So I think, yes, we're very much aware of that finding. And as far as I know, they're still looking at whether the virus, they get viral growth out of those samples. And so far, they may be just PCR or sort of sequencing detection. So that's a very important point for the study going on. But viruses have all sorts of ways of surprising us, and we are learning about something new about them every day. So I think it is possible that we will find that there can be live virus in semen. Right now, the recommendations stand in terms of how the virus is transmitted, including contact with bodily fluids, these close contacts, and contacts with skin lesions, and then contaminated objects. And so I think these intimate, close contacts, including sexual contacts, are very much part of our recommendations at the moment.
It's Dr. Njoo. It's also reflected in terms of obviously the guidance we're putting forward for what we call case and contact management. And obviously, as the science evolves, we'll adjust our guidance as appropriate and necessary. But at the present time, we are recommending that the individuals, obviously, who are confirmed of monkeypox, to not donate bodily fluids, and that includes sperm.
Laurence Martin, Radio-Canada.
Laurence Martin, Radio-Canada.
Oui, bonjour. Ma question est pour
Yes,
Dr. Njoo.
my question is for Dr. Njoo. Since you're seeing a resurgence in certain of cases in certain regions, I was wondering if you could tell us where exactly, in which regions are you seeing the resurgence, and would you recommend that a fourth dose of vaccination, the booster, be available to all of the population? In Ontario, for example, the fourth dose is only for older people, and not for everyone. Well, thank you for those two questions. For the first question, with the resurgence, it's difficult for us to give you national facts because it's only the provincial health authority and territorial health authorities that can provide scientific data. But I may have made a mistake, but with respect to our surveillance of wastewater, maybe we've seen an increase in certain Atlantic provinces and also within provinces such as Saskatchewan. But it changes from one week to another. So this is something that we can't declare that something has become problematic. We really had to follow the trends over several weeks. And if something more important happens, the provincial and territorial authorities will be making it known. But we are in a very big country, so the reality of what is happening within the territories in the north compared to Atlantic provinces, for example, or in BC or in Quebec, it's going to be different. So it's very important, and we continue to say it's important to have good individual practices and to stay up to date with your vaccination. Both Dr. Tam and myself have said that even if it's not required, it's a good idea to wear a mask if you're in a situation inside, if there are a lot of people, where you have a lot of people who are not part of your household. So that is something that is important to note. With vaccination, well, it's complex because each province and territory have their own policy for vaccination as to who is eligible for what booster at what point, but it's always a question of looking at the criteria for eligibility in your province, and if you can, if you're eligible for a fourth dose, it's important to go ahead and take advantage of that. What we're seeing in each province and territory, everyone is eligible eligible for a third dose. So that is important to go ahead after your first series of vaccination to have at least one booster. If you can get a fourth dose, fourth booster, well, that's good. I think for more vulnerable populations, for example, for people who are 80 years and older. But I think the principle is really to stay up to date with your vaccination. But I think there are probably 5 million Canadians who have done their first series, so it's important to finish your initial vaccination and then to do the booster when it's available to you for the third booster. Does the federal government announces that they were suspending the vaccine mandate for travelers, also for the public service? So do you think that was too soon? Does it worry you? Even if whether there was a mandate or not, I think that for public service workers here, I don't think it's because of the mandates, but I think that public servants really have done well with getting the information, and even before it became a mandate. I think that many of and myself, as I'm a public servant, I looked at the information, and I have been vaccinated, and I'm up to date on my vaccination, and when it's whether or not it is mandated. But what I've noted that more than 90%, I think it's 95 or maybe 98% of public servants have said they have at least 2 doses of the vaccine, and so I think that for me is really the most important fact, and not whether there is a mandate or not, but the fact that the vast majority of public servants have followed the science and decided to go ahead and get vaccinated. Even if maybe there's also boosters and people have continued. It's important to provide information not only to public servants, but and within the federal government for all Canadians. It's important to encourage them to be vaccinated and to give them the right information. Are there other questions?
Ask a question. Frédéric Lacroix-Couture.
Frédéric Lacroix-Couture, La Presse Canadienne.
Oui, bonjour.
Yes, hi. Can you hear me?
Oui, bonjour.
Yes, hello. Dr. Njoo, I wanted to come back on what you said earlier. You were saying that we're going to have a resurgence of cases over the summer, but not necessarily another wave. Well, it really depends how you define a wave. We've had several, but what we've seen over with our collective experience in Canada over the last 2 years, that if there is a resurgence, if there's a large resurgence, that could be another wave. It would happen more in the winter months, whereas in the summer, what we have seen from experience, that there tends to be less activity. So if we continue this summer with that tendency, we've seen that we've already come down over the sixth wave, and now I think we're going to be seeing less of activity of the virus here in Canada. But also, we are now seeing an increase in the percentage of the BA4 and BA5 variants. And so this is something that we need to keep a close eye on, because the BA4 and BA5 variants, if we look at what's happening in Europe, with what we're seeing in Europe, they've seen an increase of the cases in BA4 and BA5. So we have to follow, and this is something that we could see here in Canada. Thank you very much. And I want to know, as an expert in public health, do you think that it would be a good idea in the short term to stop the mask wearing in transportation. Well, I can tell you this is, in terms of a mandate of the mask wearing, this is a decision made by the ministers. For myself, as a specialist in health, in public health, we can see that mask wearing is a protective measure, an individual measure, and this is something that we can each decide to do, and science has shown that wearing a mask gives you a good level of protection. And especially with you have a vaccination that can protect you from the variants. And we've also said that if you are in a situation where you have a lot of people and where you have a lot of people that are not part of your household, it is a very good idea to wear a mask. So I think that whether or not if you're taking a plane, I think it's important to wear a mask, whether or not it's mandatory or not. So if I were to take a plane, I would wear a mask. And also, if you did get COVID, it would help to not transmit it to others.
Yeah. Health Canada announced just before you guys came on here for your news conference that the COVID Alert app is being decommissioned. There was very low uptake on it. I mean, 6.9 million people downloaded the app. However, only 57,000 users ended up entering their positive tests. I'm just wondering what your thoughts are on the decommissioning of the app and what went wrong with it. Why didn't it work to its intended effect?
Yes, I'm not intimately involved in the app, but I think with we're now, a number of years into the pandemic, with the epidemic activities calming down at this point. And as you say, the app not being utilized to a huge extent, I think the decision was made. I believe there is an actual advisory committee that oversees the app itself. And so I think it is important in such a massive, public health challenge that innovations take place. Not all innovations might work in different populations, but I think it is good that there was a good go at trying to utilize another tool in the current era of apps to try and protect the population. The app does require people, there's work on both ends of the local or provincial health departments and to hand out a key, I believe, at least like an electronic key, when someone has a positive test. And so there's a number of steps that needs to take place. So I am not sure what the major challenges with each, but it does depend on a lot of people working together. In addition to, I think, over 6 million Canadians who downloaded it. So I'm sure there'll be lessons learned, because it would be nice to be able to utilize some of these newer technologies as part of our ongoing management of outbreaks and pandemics. But we are where we are today, and I think I can't speak to the specific decisions, but I think people do have to have a go at innovation.
And just as a follow-up, I know you were asked about this in French, but just wondering about the decision by the government to end the vaccine mandates for domestic travel as well as outbound travel. What do you think? Do you think the government is moving at the right time to eliminate these mandates? Do you have concerns about this? And there is the option to bring these mandates back again should things get worse. Where do you see that threshold of when we need to reinstate vaccine mandates for travel just around Canada in a plane or a train?
So I think, as I said, we're in this transition period. We think that Canada did quite well with our vaccine coverage, but many more people do need to get their boosters to get up to date. So that is really important. As to whether mandates are the tools to get people there, that is something that policymakers will have to decide on. Just because someone doesn't require it doesn't mean you shouldn't get up to date. So it's still important. We just talked about the fact that virus activity could go up and down. The virus hasn't left the stage. It continues to circulate. It will go up and down, and possibly in the summer, but certainly we're anticipating a rise in later in the year when respiratory viruses usually increase. I think if we'll see what I think there'll be a significant campaign to get more people vaccinated as we head into the end of the summer into the fall season. So we'll see what happens with that and what happens to the virus activity. One of the key, indicators, of course, the vaccine uptake itself, but the disease activity and the impact on the health system and whether it's coping. But I have a tremendous amount of respect for Canadians. They've been doing incredible job. I think they will know that they're following public health advice overall. It is difficult when mandates are removed or requirements are removed to remember to continue to protect yourself, because I think in people's sort of, I guess is how your brain works. When someone removes a requirement, you think, oh, we don't need it anymore, which means we don't need to get vaccinated or we don't need to wear a mask. No, I think governments are leaving this to individuals who have honed some good habits, I hope, to carry on, not just protect themselves, but protect each other. You don't know who is sitting next to you on a plane. So really be mindful that you could really help protect each other. And I think they will see how this goes. But before I finish my answer, I just want to really actually thank all the public servants. This is National Public Service Week. And I think there's a lot of people that I think deserves a thank you for all the work that they've been doing. At the federal level, the public service has over 98% vaccine coverage already. So we think the mandates have done the job from that respect. I still would like to encourage every public servant to get up to date. And so, j'aimerais dire un grand remercier.
So I would like to thank all of the public servants across the country for a big thanks for following the public health advice.
Get up to date with your vaccines.
Thank you. Are there any other questions? Y a-t-il d'autres questions?
Are there any other questions?